Welcome back. This is the final segment of our class. Remember, we said at the very beginning, this is all about the patients. Patients come to us when they're extraordinarily vulnerable. They feel badly, they're worried, and they expect us to use all of our medical knowledge that we've worked hard to learn in the years we've spent in each of our health professions schools to help them understand what might be causing their signs and symptoms and to hit upon an appropriate diagnostic and therapeutic strategy for them. So let's follow up on the patients that have been moving through this course with us. Jeremy Leader. Remember Jeremy, he was 15 years old and he had a very sore throat. His diagnosis was acute mononucleosis. Unfortunately, his course was complicated by hepatitis, and he was out of school for about 2 months, which sometimes happens with this. However, he returned to school with an admonition to not engage in contact sports until his spleen returned to normal about 6 months later. Sophia Ballara was 17 years old. Her chief complaint was her ankles hurt and she couldn't walk, and her diagnosis was disseminated gonococcal infection. She was treated with ceftriaxone and recovered fully. No other STDs were identified, and she is now in a different relationship using condoms. Anna Garcia was our 59-year-old woman who complained about shortness of breath and had been misdiagnosed as having asthma and panic attacks by several other physicians who saw her at different times of her illness. Her ultimate diagnosis was stage 4 non-small cell lung cancer with malignant pleural effusions, and she was referred for a clinical trial. Mr. Durrett, who is 85 years old, his chief complaint was, "My husband is confused and not himself." First, out in the hospital after his aortic valve replacement, he developed polyarticular pseudogout, and then treatment of that led to an episode of delirium. He's back home now and doing well with his new valve, and the pseudogout has not recurred. Mrs. Triglione had a very complicated case. She started off with shortness of breath that turned out to be a postoperative DVT. Then she became dizzy and nauseated and was found to have a brainstem stroke due to a paradoxical embolus. She was treated with Coumadin and is now undergoing vestibular rehabilitation, but is still mildly disabled 9 months out from the event. And Alicia Jones-Hopper was our 35-year-old who had a complaint of recurrent stomach pain. Her diagnosis with acute cholecystitis, she underwent cholecystectomy and is doing very well. So let's regroup. Developing good multiple choice questions for standardized exams uses the same compare and contrast learning and key and differentiating features that we've been working on over the 6 weeks of our clinical problem solving course. When you're faced with a difficult exam question, use the same skills we've taught you to use over the past 6 weeks. Process the problem list, develop a patient illness script, and then work through the answers, comparing the patient illness script to the possible diseases that are offered or embedded within the answers. The tools of clinical processing, the tools of processing and explicit illness script development can be used as tools in the teaching of clinical problem solving in both the classroom and at the bedside in the clinical arena. Students can quickly understand and learn these terms, and then this type of language or shorthand allows you to be very explicit about helping them understand where they're doing well and where they might in fact need a little additional work. We hope you've enjoyed this course on clinical problem solving. I've certainly enjoyed watching you wrestle with the homework. I appreciate the time you spent in helping each other answer difficult questions, and I'm sure that the patients you care for in the future will be grateful for the time you spent with us this past 6 weeks. I do ask that you fill out the course evaluation, which you'll receive electronically within the next week. It will help us make sure that this course continuously improves to meet the needs of your colleagues who choose to take this in the future. Thanks again, and good luck taking care of your patients.